We have 3 sites, and so trying to take a paper record from one site to 2 other sites is a real challenge.
We were having a lot of issues with having patients showing up where their physician was, and we as a group rotate offices. And so there was always the problem of the paper chart not being available at the location we needed it.
We have a wide age range of pediatricians in our practice. Some are good with computers, others aren't. And so ease of use was very important to us.
We're pediatricians, and we see patients quickly and do a lot of sort of repetitive things, and we had to have a system where we could do that easily and have a chart that would be useful and include all the information, plus be able to put in growth charts and immunization records and have them be current and remind us when things weren't current so that we would keep all that up to date. Intergy as a system, I think, is one that's worked very well for us.
Since Sage Intergy Suite was installed, we have seen tremendous efficiencies.
For pediatrics, I think it's a very good system. We looked at other systems before. It is streamlined to use in pediatrics in terms of medications, immunizations, growth charts.
We installed the clinical aspect in 2005, and then in December 2008 we added the practice management system, and we've seen efficiencies in our clinical processes through medical records. We've seen efficiencies in our phone calls. The practice management side, we can make appointments much more effectively. We bill more quickly and cleaner, a clean claim, than we have, although we did pretty well before. Our medical records staff can gather information much more quickly than they were able to before.
The availability of communication between offices and having accessibility of records has been a big impact on patient care, whether it's during the day or even at night.
The impact of converting to Intergy, Sage Intergy, on practice financially has sort of been fairly dramatic. And we did it not necessarily to make us be able to see patients faster, be much more efficient in the actual process of seeing patients, but to make all the other jobs we do in the office much more efficient and to give us better documentation. The records we get are much more complete and much more acceptable by insurance companies, and certainly allowed us to bill at higher codes and document the work we've done and get paid for it.
We had a huge room here for records. This office was built for that. Since that time, since we have eliminated paper completely, we've been able to add exam rooms in the space that we've already had.
The biggest benefit we've seen from the EHR is just having all the old information right, in your hand with the computer when we're seeing the patient. Before we go in a room, I'll review data, I'll cite some old information in and review some of the medicines and problems and things, and know pretty well the patient I'm seeing, if it's a patient I don't usually see. This is applied equally well when we're not in the office and we're home and people call at night, or when nurses are on call and they've been able to get the records.
When we first started using these records, we had a committee to help with making templates for pediatrics for routine illnesses as well as checkups. So they've been customized for pediatrics, and we all use them. The templates for illnesses, each physician seems to pick a favorite, and you get very used to using 1 or 2 of them, and you're able to go through it fairly quickly. Some of us type, some of us write, some of us use the pen, but you do get to use a certain template over and over again, and it's made it efficient.
Growth charts have been something that I think have been a lot easier to use since we've had the record. We certainly, as patients come in for checkups, I'll usually look at the growth charts and show the patients or the parents how they've grown. in the last few visits, and people sort of appreciate seeing the trends. It's something that becomes more important once you've been on the system a few years, because those points accumulate, and until you've got a series of points and you can see trends, it doesn't mean that much to parents. They can see that the child's in the middle of the chart or at one extreme of the chart. Once you've got data there, though, it's very easy to show that they're growing well.
Since we've had this system in place, I think probably about 4 years now, it's plotted instantaneously, and many of the parents want to look at that. Whether it's plotting their mass, their growth, their head circumference, it's instantaneously available. The patient looks at it, and we could show where we have concerns. In the past, it had to be plotted specifically on paper, and it was a lot more cumbersome. The immunization feature pediatrics has gotten more complicated with immunizations, numbers. There's a lot more room for error. By having this available in front of you, I think the number of errors has gone way down.
Having electronic medical records where you actually order, administer, and charge for the vaccine while you're doing it sort of ensures that you're going to have accurate records and that everything is up to date. Plus, we've built in reminders to let us know what immunizations or when immunizations are due.
The benefits in terms of streamlining what we do, one of the things we do on a daily basis is prescriptions. We use the system to email prescriptions to pharmacies instead of having to write them out, hand them to patients. They go there, and the patient could go to the pharmacy, pick them up.
A doctor or a nurse or a medical records individual can say, look here, here's your growth chart, or I'm doing this prescription, see what I'm writing for the script here and the directions. Do we understand each other? And everybody can see it. It can be very interactive instead of being an inhibitor to communication.
We are seeing probably a lot better documentation with short visits like otitis media and colds.
The person who comes in, the child who comes in with otitis media, ear infections, it was more difficult to figure out how many that child had had, particularly if they had been in for other things in between, with using a patient chart, a paper chart. In the electronic medical record, anybody can see very quickly that this child's had 5 ear infections in 6 months or in 12 months and make some judgments based on that information very quickly.
Patients have been pretty appreciative of what having an electronic medical record, and particularly SAGE, has done for us. You particularly hear it in the evening when I'm talking to people, or even during the day when people call and they'll ask if I have the record in front of me, and I say yes, or if they need a form or a list of immunizations, to have everything available right away makes everybody pretty happy.
And if a concerned mom says, boy, my child has another sore throat, do you think I should bring him in? I think it's strep again. They can again see quickly how many there have been and suggest that perhaps when they do come in today that they talk to their doctor about a referral to a specialist.
Patients are pretty impressed that we have a system that seems to be working and that's helping us to take care of their children. There's always positive responses when they see the charts, or they look at the growth charts, or they can get the immunizations on another child or something right away.
When we do spend time on the chart in front of patients, and the patients now are expecting us to have the records in front of us and all the immunizations and all the medications the patient's on. Now when a 3-year-old comes in, they said they were playing doctor. What were they doing? They were charting on the computer.
Intergy touched each and every one of us. Our patient educators never thought that they would be talking to a person and dealing with a computer at the same time. Our doctors again had the concerns about, am I going to be giving better care or worse care because I have to deal with a computer? They think they're giving better care now. They've got a better picture of this person.